Lyme disease, I'm sure most of you have heard about it by now, but perhaps may not understand the prevalence of the bacteria that's in our wildlife population. Today we're going to learn a little bit about how Lyme disease arrives in our area, what it's all about, and some prevention methods that you could take to avoid contracting Lyme disease. Now, I don't know if any of you have heard or have somebody in their family or have heard of somebody that has Lyme disease, but more and more people across the country are finding that they now know of somebody or have heard of somebody who has contracted Lyme disease. The reason for that is a lot of it has to do with awareness. It's also on the rise, but I think the awareness is ahead of the actual spread of the disease in our country. I think the disease itself has been here for some time, just that better testing, better awareness, and better education of the general population is now resulting in more people getting a proper diagnosis for an illness that many people have had for years and only just recently found out it was actually Lyme disease. Now, what is Lyme disease? If you look up here at this picture, that is the Lyme disease bacteria called a spirochete. It's a Borrelia bacteria. It is a distant cousin to the syphilis bacteria. It's significantly different in how it operates in the body and how it's transmitted. It's much more difficult, we believe, to sexually transmit Lyme disease as opposed to syphilis. But having said that, as research progresses, we're going to learn more about that. There's a very, very small study out that indicates that it can be sexually transmitted. Much more research is required before anybody can state with confidence that that's in fact the case. But it is something that has to be looked at seriously. Currently in Canada, the testing model is called a two-tier test protocol. It's a screening test, and only if that screening test is positive or equivocal will they then go to the next step, which is supposed to be a confirmatory test. The problem with the Canadian setup that we have for the protocol is that neither step is good. So you're compounding the likelihood of getting a false negative by having both steps as inadequate steps in the process of testing. And why they're inadequate is because they are incapable of detecting the genetic diversity of the Borrelia bacteria that we have in North America and globally. It's not a North American disease. This is a global disease. It's on the rise. It's occurring now at far many more times annually than AIDS and other known illnesses. The United States Center for Disease Control on August 19th of 2013 issued a press release adjusting their numbers upwards. Instead of the thought to be 30,000 annual cases, they upped it to 300,000 cases per year of Lyme disease, and that's in the United States. The likelihood that Canada is still only seeing under 500 cases in the entire country, which is the official number, it's very unlikely, and it's just unrealistic to have that expectation. We don't have protective borders. Our migratory birds are how this disease is spread. And so if any area of Canada that gets robins and other songbirds and finches and whatnot that come every season, you potentially have Lyme disease, because that's where that's where these ticks are being carried in on, is our migratory bird population. And they're being brought in at a rate of about 250 million. Now this is just an estimate. 250 million ticks per season brought in from the very Lyme endemic areas of the United States, because there's very specific migratory flyways. And these, here in British Columbia, for example, our one major migratory flyway is the north-south flyway from the Pacific coast. So California has areas of very high endemicity, meaning there is a lot of infected ticks. And so those ticks can be in somebody's backyard in California on a Thursday, and by Saturday or morning or afternoon, they could be in your backyard here, care of one of our migratory birds. So we have a very good chance that our numbers are very, very, very underreported in Canada because of that fact, and because of the testing. Now there's another current piece of research that was, and I'll get to that in a moment here. There's even newer research showing that the California ticks that come to British Columbia are carrying another strain of the Borrelia bacteria that there currently is no test for in Canada. And they have found that just as many or more of the ticks that they're now testing, now that they've identified this Borrelia bacteria, just as many of them are carrying that particular Borrelia that we're not testing for. And that particular Borrelia is also causing symptoms in humans very similar to Lyme disease. So we try and refer to Lyme disease simply as a borreliosis, because we're discovering more and more species and strains of the Borrelia all the time, and finding more of them that are becoming that are actually human pathogens. They are causing disease in humans. So we prefer the term borreliosis because it's broader. We're currently sort of defining Lyme disease by that poor two-test model, testing Borrelia burgdorferi laboratory strain B31. And anybody who tests positive to that, then they define their symptoms and their circumstance as Lyme disease. Well, we're finding that that's sort of the backwards way of doing it. You've got to define the disease by the organism that's causing the disease, and there's far more than just Borrelia burgdorferi strain B31. So as time goes on and our knowledge and our testing improves, we expect the understanding and the number of cases that are being identified to rise substantially. Here's just some information about that. You know, Lyme is not new. It's been around for a lot of years. And there's also, I don't know if any of you saw the National Geographic article from a couple of years ago, but the Iceman, they call him, the mummified body they took out of the ice of the Alps, out of the glaciers back in the early 90s. When they actually did the autopsy and using DNA sequencing technology, this 5,000-year-old mummy, the only bacteria they identified in the joints of this mummy was the Lyme disease bacteria. So it's not new. It's been around a long time. We've just been calling it everything else. We've been mislabeling people's diagnoses. As I had mentioned, in British Columbia, we already know we have many different strains and species, and some of them that have been identified are Borrelia bissettii, Borrelia hermsii, and of course Borrelia burgdorferi, which is the one that we're testing for, and now Borrelia miyamotoi. There are others that we've identified too, but I don't want to get into a long list, because then you start really having defined what is a species, what is a strain of the bacteria. But right now, these are significant enough. Borrelia hermsii and Borrelia miyamotoi are more closely related, and Borrelia burgdorferi and Borrelia bessettii are a little more closely related. But they all cause human symptoms that we should be referring to as a borreliosis, rather than trying to say somebody is negative for Lyme disease simply because they haven't passed this Borrelia burgdorferi test. And that's, if we can finally get that built into our structure, into our system of diagnosing in Canada, then hopefully people will stop getting the wrong labels put on their illness. We're getting people with Lyme disease told they have MS, or told they have chronic fatigue syndrome, told they have various forms of arthritis or fibromyalgia or lupus, and the list goes on, because with a disease like Lyme disease, it's a multi-system disease, so it's causing all kinds of neurological problems, heart problems, cognitive function problems. Your brain doesn't work right. It can cause muscle weakness, spasms, seizures. So it can affect the bowels, it can affect the kidneys, it can affect the respiratory system, the lungs. So it's being labeled as a whole lot of other things, when in fact the cause of much of this has been Lyme disease all along in an unidentified percentage of our population across Canada. The 2010 Canadian Health Survey that was published indicated we have about 2 million Canadians suffering from these conditions of unknown origin, of which all of those are that I just labeled. We don't know what percentage of that 2 million are actually Lyme disease. We know there is a significant percentage that are. We just don't know what that percentage is, if it's 1% or 5 or 10. And hopefully, as our testing and research improves, we are going to start to be able to put a known cause to some of these currently labeled unknown cause diseases and conditions. Testing is going to improve because the technology now with next generation DNA sequencing is so vastly improved from where it was a decade ago. But still we need to do a lot of research and a lot of homework to get that model to where it's actually functional in the doctor's office. Because right now, I don't think too many people would have to go in for a liver biopsy or something like that every time they want a test. Because right now we just don't have a good blood model for that type of test. It's more tissue and organ tissue and that sort of stuff. There's just a little older graph that was created by the European group, and that was published in the World Health Organization report. Now, as you see, some of these countries, and a lot of these, you're looking at these huge numbers there, and few numbers there, few numbers there, and there. A lot of that, again, is the testing. So it depends on what testing model they're using. And in Europe now, for example, Germany is through the roof. England, which isn't even on there, is now seeing significant numbers, and Scotland and Ireland, but as you see, Canada didn't even make a blip on this chart, because it's a combination of reasons as to why we're so far behind the 8 ball here in Canada for diagnosing and recognizing this disease, and a lot of it is that there was no initiative on behalf of our governments to actually go and look seriously. The only real initiative that has been the really aggressive one was actually begun here in BC by Dr. Gehrig, a practicing GP from Squamish, whose daughter he found out had Lyme disease, and him working with Dr. Banerjee, who at that time in the late 80s was the head of vector-borne disease at the British Columbia Centre for Disease Control. They actually put their overalls on and their gumboots and went out in nature and looked. And pretty much wherever they looked in BC, they found Lyme disease. They compiled all their data, and in 1994, it was published in the BC Medical Journal. Unfortunately, since their retirement, none of that information seems to have been taken seriously, although we at the Canadian Lyme Disease Foundation take it very seriously because we're seeing numbers in British Columbia that are far higher than what the government is reporting. And typically, officially in British Columbia, there are fewer than 10 cases per year in the entire province. And we're of the opinion that number is absurd. Now here's, again, in memory of who Dr. Gehrig, who was my initial doctor back in the early 90s, who diagnosed me with Lyme disease, and Dr. Banerjee, who, after his retirement as head of vector-borne disease at the BC Centre for Disease Control, he retired in '97. And when I started the Canadian Lyme Disease Foundation in 2003, I contacted him to see if he'd be willing to join my founding board of directors, and he jumped at the opportunity. And so he was a very big part of the formation of Can Lyme in the early days until his sudden death, unfortunately, in 2007. And Dr. Gehrig went on, he retired at about the same time in the late 90s and went on and received the Order of Canada for all his good work, including Lyme disease and other. So this is just some of the material they developed. And it shows that Lyme disease, even back in those days, was spread throughout the province quite well, and here in the interior as well. So it's unlikely, very unlikely, that the numbers that the provincial government are putting forward, it's extremely unlikely that those numbers have any validity because of the type of testing that they're doing, and they're not releasing any published data to support that they're even looking for these other Borrelia that we know exist out there. Other areas are now starting to look. In the east coast of the United States, for example, they've just discovered that Borrelia americana is making people sick, Borrelia californiensis is making people sick. So it's the Borrelia andersoni. We have all those in Canada as well. So we need to insist that our BC Centre for Disease Control start telling us what they're doing, because we keep asking and they keep saying, it's okay, you're in good hands. But we keep asking them for the data, because the one thing in science is you can't just say you're in good hands. You have to provide the data. Where is the data? It's not fitting. When the ticks that are coming from California that are arriving here in our ecosystem every year in the millions, when these ticks are carrying multiple strains and species of Borrelia that we know from statistically that they're not testing in BC, or certainly not releasing the information. If they are testing, then we know that our numbers are really, really skewed. We just don't know how badly they're skewed. But currently, right now, nobody in British Columbia who suspects Lyme disease is getting looked at to see if they have Borrelia miyamotoi, which is in as many or more ticks than the one we are testing for, Borrelia burgdorferi. And there's some of the rest of Canada. And these are data from a decade ago. So this isn't current. So again, it shows that there's a lot of Lyme disease. It's spread right across the country. So very little data coming out of Alberta officially, but there are a significant number of people now testing positive for Lyme disease in Alberta as well. So, and again, because we're such a global population now, you know, people are traveling and people are flying, they're in their RVs, they're going camping, they're everywhere. So the tests that we have got to be more universal than they are. One thing that research is showing us too is that this bacteria has the ability to localize quite, in terms of bacteria, quite quickly. So what they're testing for now may have evolved into something that's not as easily detectable using the same method. So most microbiologists now recommend that we try and use localized, regionalized strains of the bacterial organism if we're going to be developing these assays, these tests, because of this localization. We've already got the lots of research on the genetic diversity, but then you add this ability for the bacteria to localize on top of that. And so testing becomes extremely problematic, as you can see from that perspective. Now, the symptoms of Lyme disease, this is kind of a difficult discussion to have because, again, all of the research and what your doctors are expecting to see as a symptom of Lyme disease is often not what occurs in Lyme disease. So, for example, most published research that is given to doctors indicates that 70 to 80% of people are going to get this bullseye rash, or a rash that is similar to a bullseye. When in fact, the most current research has stated quite clearly that only a small subset of the Borrelia bacteria will cause a rash of any kind. And of the rashes that do occur, only 9% take the actual bullseye form. So, but for the last 3 decades, in every piece of literature that has gone to the doctors, there's this big picture of the bullseye rash with these percentages of 70 to 80% or 60 to 80%. And in a very fast-paced doctor's office, these are the only things he's remembering from his material that he's educating is, okay, you need the rash, and then it says another material, 60% of people are getting the Lyme arthritis. Well, we're certainly not seeing that anywhere near that in Canada. And in Europe, they already know they have quite a vast difference in presentation of symptoms between the different strains that they have there. So we should be expecting the same here in Canada. And we've got a mixing of strains in Canada because of our migratory flyways. We've got north-south flyways that are bringing in ticks from the United States and beyond. There was actually a tick found in, I believe it was Grand Prairie, Alberta, that prior to that had only thought to exist in the southern hemisphere in Brazil. So it managed to find its way all the way up, and I believe it was taken off a rabbit in the Grand Prairie area. So this mixing of strains of the bacteria is affecting also the presentation of symptoms in people, because there are strains we know, especially the one they're testing for, because they enrolled a bunch of people with the big swollen knees from Lyme arthritis, and took their antibody response and developed a test for it and gave it to all of us and said, if you don't test positive to that test that's really good at picking up big swollen knees, then you don't have Lyme disease. They didn't consider the fact that most people with Lyme disease don't have big swollen knees, and that therefore their antibody, their immune response that is causing that big swollen knee is different in those other people. So therefore the test has to be different. And so they also enrolled in those same studies, the people who had these nice big bright bullseye rashes. Well, unfortunately, most people with Lyme disease don't get that big, nice, bright bullseye rash. But again, they enrolled those people in with this study. They took their blood, and that's what the antibody presentation in those blood samples became the basis for describing everybody with Lyme disease. So it's kind of a backwards way of looking at illness, is we're defining the illness by exactly what we expect it to be. And then what they did is they take the blood from these big swollen knees and these bright rashes, and they collect it and save it at the United States Center for Disease Control, and they use that criteria that's in there, that immune response, that antibody response that they expect to see, and they create these pre-manufactured kits, but the CDC dictates to the manufacturers what is to go in there, and it's only the one that's going to pick up the big swollen knees and the bright rashes. And then the manufacturers, they distribute them to all of the government-type provincial, federal labs, not only in Canada, but throughout any of the countries that are affiliated with the United States Center for Disease Control, and it becomes the official test. And you can't get anything else through the government, even though there's many, many other tests out there that are multi-strain, that are using multiple strains and different ways of looking at it, not just the antibody response. So we've created a system that this test is defining the disease. They've created an entire network of manufacturers providing these kits from these big for-profit companies. So it's quite an industry, and it's throughout the globe. It's not just in North America. And when we approached one of the companies that provides kits to the Canadian federal government, we asked them how come they're only testing for one strain of one species. They wrote us back and they said, we are told what to put in our kits by the United States Center for Disease Control. If you want broader testing, we suggest you get a hold of a laboratory in Northern California called Gehrig. This is the very same laboratory that we've been using for a decade that the government criticizes so badly as being just out there giving false positive results for a fee, which is nonsense. It's actually a lab that's working and helping people. Now, this whole variety of symptoms that comes with this variety of Borrelia causes problems for the doctor and everybody to figure out what is Lyme and what isn't Lyme. And this is why it has to be a clinical diagnosis. There is no one test that you can rely on. They certainly shouldn't be relying on the two-tier test protocol that we have right now in Canada. That should be scrapped, basically. It's not a good test. If they're going to continue with this antibody testing protocol, certainly they've got to start using multiple strains, multiple species, and they have got to stop making statements of confidence about these tests as being good, they are just looking for antibody response. They're not looking for the actual organism in the individual. That is extremely difficult to do because finding the bacteria when it's a Borrelia is very difficult in humans because it's compared to, say, strep or one of the other bacterial infections. where you could have millions of the bacteria in one sample. The actual bacterial load count for Lyme disease bacteria is very, very low in the body, making it extremely difficult to actually detect. So this broad spectrum of symptoms, the brain, your memory can be very severely disturbed, right from just mild memory, unable to find the right word in a situation that you normally would be able to find the word, right all the way through to severe dementia type memory problems. And in fact, some of the research done by Dr. Judith McCloskey, also a founding board member of CanLyme, she's back in Switzerland, but her research has shown that 90% of Alzheimer's brains carry the spirochetal bacteria, not just Lyme, but Lyme and the Treponema type bacteria. So Borrelia and Treponema, spirochetal bacteria. And then she was also able to show that in some situations, or in the situation of where she introduced the Borrelia, the Lyme bacteria, to healthy brain tissue, she did that trying to find out if that would cause the deadly amyloid plaques that destroy the brain tissue in Alzheimer's. And sure enough, after a week, she had a full bloom of the amyloid plaques in what had been healthy brain tissue. So that's a lot more research has to be done on that. And she's actually in Europe right now heading up an Alzheimer's research foundation there. So another one that goes largely under-recognized are the psychiatric aspects to these infections. More and more reports are coming out about schizophrenia and other things actually having an infectious, an organic basis to them. They're not just a chemical screw-up in the brain. They're actually caused by something, an infectious cause. And we have seen in people bipolar, schizophrenia, hallucinations, both auditory, hearing sounds that don't exist, and visual hallucinations. So that can all occur in Lyme disease. Severe headaches, right? They can occur, even the cluster type migraines we see in Lyme disease, headache, or just non-cluster headaches that just won't go away. They're there day in and day out. There's thickening of the blood is seen in many people with Lyme disease have to end up taking blood thinners. There can be arthritic system, rheumatic symptoms, rheumatic symptoms. You can have paralysis, muscle spasms, seizures, heart problems, range from palpitations, which we see mostly, are not serious palpitations, through to third-degree heart block and also regurgitation because valves are messed up. There's all kinds of heart issues that can come as a result of this, the bowels, and it can range all the way from almost uncontrollable diarrhea right up to serious constipation. So again, it depends on the person, it depends on maybe the strain, but likely mostly the genetic makeup of the individual themselves as to whether they're going to get diarrhea, constipation, or either. Some people get none of that. And eyesight problems, they can, many people with Lyme disease report a sudden drop in their what was once good vision suddenly becomes noticeably different and poorer. And they also, in the eyesight, people are reporting, and I had visual disturbances in my situation with Lyme disease. Some people get this barrage of sparkles that happens in their eyesight. Other people, like myself, get waves, peripheral waves, or waves in front of the vision, and spots. And you can get these black spots that float all over in front of your vision, and making it extremely annoying for one thing, and concerning for another, because until you've got a diagnosis, you don't understand what that is and what's causing it. And luckily, with treatment, in 99% of the time, that's all going to go away, and you're going to get your normal vision back. Although, if your vision, in some people, they will still have to wear reading glasses and whatnot. Quite often, you can't seem to recover that ability to focus again and read in dim light and that sort of stuff. So it's a very difficult disease to diagnose because it affects all those systems of the body. From a doctor's perspective, it's a nightmare, because how do they differentiate between other conditions that cause a lot of these problems? The main difference with Lyme disease is it's going to be more than one system affected at a time, and usually multiple systems. So you're going to have your brain, your cognitive function disturbed. You could possibly have heart issues going on along with respiratory or arthritic or muscle or gastrointestinal. Most people have at least 3 systems of the body that are affected at the same time. And again, that is why so many people are getting diagnosed with other labels when in fact it's Lyme disease, because it is the great mimic. It looks like a lot of things, but maybe a lot of things are also Lyme disease. And now in the multiple sclerosis link to Lyme disease, I know the research that I have read goes back as far as 1911, where they've been actually able to visualize these spirochetal bacteria in MS patients. And sporadically throughout the literature since then, there's quite a bit of association with these spirochetal bacteria and multiple sclerosis, and an awful lot of people with MS in Canada are now finding out that it was Lyme disease all along. Many are, their health is improving significantly. A lot of people have been brought out of wheelchairs, put their walkers away, canes away. Vision problems have resolved themselves. So we've got a lot of homework to do. There's a lot we don't understand about Lyme disease. The biggest thing that we don't understand about Lyme disease is how prevalent is it in the human population in Canada. And that is really significant. And it's what we don't know about tick-borne disease that is the most alarming, because as science improves, we are starting to identify other infectious agents that are potentially not only coming with Lyme disease, but maybe causing disease on their own by themselves as well, that could present possibly as Lyme disease, or some of these many other labels that people are given. So it's what we don't know, I think, that is so significant. But it is very encouraging to know that science is developing rapidly beyond where it was a decade ago, and that we are going to be able to put some answers to that, some of those questions as to what's causing, a lot of the labels that 2 million population have been given in Canada of unknown origin illnesses and conditions. So, there is lots of good stuff coming down the pipes. It's never fast enough, but it's coming. The biggest challenge for us is to help change that medical model from the old thinking that rapid number or image that they're given. They're given the bullseye rash, they're given the 60% Lyme arthritis, they're given low or no endemic areas. You know, that is all incalculable because we can't determine where birds are going to fly. So there is no good way of telling where Lyme disease is or isn't. And by using that probability ratio of trying to think you understand where Lyme disease is or isn't, is affecting how the doctors perceive Lyme in their areas. So unless a doctor is in an area that they know has been labeled as a high Lyme endemic area, it's not even on their radar. And this is 2013. So they're not even considering Lyme disease in a differential diagnostic workup. And just this week from a region in southern Ontario, which is very Lyme endemic, the infectious disease doctor that the person was sent to told the person that we don't have Lyme disease in this area and you didn't have a rash, so we're not even going to look at Lyme disease. You couldn't get worse medical advice in 2013 than that. Yet the symptom profile of that individual was classic. Screaming further investigation for Lyme disease, more thorough investigation for Lyme disease. They shouldn't be just doing the two-tier test protocol. They can be contacting some of the researchers and getting, there's an ELISpot test that could be done. There's a CD57 test that tells the immune system function. Combine all of those tests and then look at the patient's symptoms. And once you've done the differential diagnostic workup and ruled out all the other things, if you still can't identify it, yet you've got all these objective signs that it could be Lyme disease, the next obvious step is to treat the patient to see if they respond like it was Lyme disease. But we're just not seeing that occur in our Canadian medical offices. There's a block there somewhere. So I think, as usual, it's the individuals that have to take it upon themselves, for themselves and their loved ones, to be their own advocates in healthcare. And it's something we can all participate in changing the medical model too. And it's done from many different fronts by talking to your doctors, talking to your nurses, talking to your pharmacists, talking to your elected officials, your MPs, your MLAs, even regional health authorities. Give them heck when they're putting out bad information or you see information, statements of confidence. Now here is the April 3rd, the review from Karameas. And this is the Dr. Jennifer, no, she's not a doctor, she's Jennifer J. She's a communicable disease specialist, so I guess she is a doctor, within Interior Health. So just on the 3rd, they put out here that they only get 2 to 4 cases of Lyme disease in the entire Interior Health region, which is huge. It goes from Kamloops to the United States border, takes in the Kootenays, the whole Okanagan Valley, and only 2 to 4 cases per year. You know, we call nonsense to that because that's absurd. They're using the wrong test, they're basing everything on the wrong test, and they are not educating the physicians to the proper clinical diagnostic methods. And so this type of material, these statements of confidence, we only get 2 to 4 cases per year in regions, that immediately lowers the guard of the people and it lowers the guard of the doctor, making the next person's diagnosis that much more difficult to get, especially in that early stage when it is so easily treated. Within the first few days of a tick bite, treatment is very successful, and the patient will then typically never have to look back. But once it's gone beyond a week, 2 weeks, and the bacteria has had time to disseminate into the deep tissue of the body, it becomes a much more challenging condition to treat. And limiting it to weeks, 3 weeks of antibiotics or 4 weeks of antibiotics, that is simply unsubstantiated by science at the current time. So there's no reason to put a limit on the treatment, because it has been shown in science that after massive doses of antibiotics, once it's disseminated, that the organism has the ability to survive beyond even 3 months. So this is why some people, including myself, have had to be treated well beyond 3 months. And but the problem is the treatment is effective if it's allowed to go beyond that period in many, many people. And we're seeing it all the time. These people that I referred to with MS and whatnot, they would not be seeing the improvement that they've been seeing and recovering much of their life had they been forced to follow just 3 or 4 weeks of antibiotic treatment. That is not cutting it. Once that disease is disseminated, it's difficult to get at. And you need that ongoing antibiotic so that there's several life cycles of the bacteria covered. It's got to be able to penetrate the type of tissue that this hangs out in. We all don't metabolize antibiotics the same way, so there's a lot of variables. And there's also other diseases out there that they already know they have to treat with long-term antibiotics. They shouldn't be looking and putting labels on something they don't even know much about yet. We're still learning about borreliosis and still finding new strains and species that are affecting humans. So it's far, far too early to start boxing this disease in and tying the hands of doctors, yet they've done that very effectively. And it's got to change. Anyhow, so any questions? Yes?
Have they changed your testing? Because years ago, I was in Kelowna, Dr. Marinaki, and here it used to cost about $300. We had to send our blood work to the States to get tested because the Canadian ones wouldn't do it right, and they were still trying to lock, if a Canadian doctor treated you, and if he went beyond time frame, they went in and tried and shut his office down.
Nothing's changed.
Okay, because he found the Lymes in Harrison, Agassiz in the prison there in the 70s.
Yeah, that was Dr. Murakami from Hope. Yeah, and he was also on our founding board of directors. And yes, he did treat very successfully a large number of people who had been diagnosed with other conditions. As a result of all that good work, his reward was that the College of Physicians came in and shut him down. And they harassed him for 2 years. Daily harassment sometimes, coming in and making his patients sign slips saying that he's under investigation. And this is a man who was an associate professor at UBC Medical School for years and also head of the Fraser Health Authority. You know, if they want to shut something down or if they want to instill a dogma in our medical system, they can do it because we have given them so much authority. They can do what they want, when they want, and that's what makes our healthcare system so dangerous at the moment, is there are so many influences out there on the for-profit side that healthcare can get really misdirected, and there's really nothing the public or our politicians can do about it at the moment. And I think that's reflected in how many years Lyme groups in Canada. The first Lyme Association in Canada was formed in 1989 by Dr. Kindry's daughter, Diane. And right from the get-go, she was trying to change through that Lyme Borreliosis Society of BC how Lyme disease was tested, how it was perceived, and how doctors were taught about it. In 1990, the Lyme Borreliosis, or Lyme Disease Association of Ontario was started by John Scott, who has now published a great number of papers showing us just how these migratory birds are responsible for transplanting these ticks in such vast numbers randomly all over. Not only do the birds transplant the ticks, but they are reservoirs for the disease. So they harbor the disease in their blood. So any new ticks that jump aboard these ticks for a ride to the sunny Okanagan from somewhere who aren't necessarily infected, on the ride they'll feed on the bird and they will become infected, and during their next feed, if you happen to be on their list, then you can potentially become infected. But no, nothing's changed, you know, in the whole thing. Oh, I've got one. Thanks.
Do we still have to pay to get a proper test done?
Yes.
And what was the cost of that? Because they tested me, because Dr. Rankin, he told me prostatitis on men is one of the diseases that's mimicked. They treat you for prostatitis and it's actually Lyme's. And the test they did here, it came back in 3 days, so it couldn't have went to a very far lab.
Right, the one that the $300 test went to a lab in the States.
Yeah, you had to put it on the plane right away, right?
Yes, yeah. Yeah, and it's still, unfortunately, you're still going to have to pay for it. Those labs in the States, like I say, are picking up cases because they refuse to follow that long since discredited two-tier protocol. The two-tier protocol and the criteria looking for antibodies that was set out, it's called the 1994 Dearborn criteria. So they made that mandatory across the board for labs and whatnot to start following this criteria. And then in the 1995 International Rheumatology Conference, Dr. Paul Fawcett, a rheumatologist, showed at that conference of 66 children with confirmed cases of Lyme disease, using their new criteria, only 1 out of 3 of those children would test positive for Lyme disease. And so he was under the impression, with this very objective evidence of this study, that they would change the test because it's going to miss 2/3 of people with Lyme disease. But instead they did nothing. And they have done nothing since 2013, or since 1994.
I was just wondering, is it possible to have a tick bite you and not know it? And
Most people do not know that they've had a tick bite. Yeah, and most people do not get a rash or see a rash.
so you just suddenly you just feel tired, and the only way you would know is if you got tested.
Yep, that's, well, tested, your symptoms. One good thing about the internet now is that if you start typing in your symptom profile in the internet, and if it's covering as many systems of the body as that, along the line you are going to come to Lyme disease. And then that often prompts people to start investigating. And it's then in that investigation and in that journey that they actually find out that their downturn in their health, their poor quality of life is actually Lyme disease. And that's when they seek out treatment, and if they're aggressive and actually follow through and get the treatment, regardless of what the standard medical opinion is, those who let their their own heart and their own mind guide their way, and if they feel that this could be Lyme disease and go get the diagnosis and follow through with treatment, those are the people that are getting well. And what I worry about is that, what I believe is the silent majority out there who aren't following through because they were told by their doctor and they believed their doctor that it couldn't be Lyme disease.
I had the results from the IGNX lab in California on my lap that I have Lyme, like severe Lyme. I was told years ago I had MS in 1977 and again in 1986, and this was before MRIs, and again in 2008. So I went and got tested for Lyme through the IGNX lab, and yes, it does cost for the Western blot about $267. Believe that's included shipping. And I had gone to my doctor and got the ELISA test, which is the test in Canada, and with my very severe symptomatic test on my lap from the IGNX lab, going, boy, do you ever have Lyme? She goes, sorry, you were non-reactive. You don't have it. So, thank you, goodbye. And I went, I know her hands are tied because they don't want to do anything for you, but she really believed that. So since then, I'm trying to think of a way to approach her to say, you know what, you're wrong. I do have it. But I haven't really found a way yet to approach the medical doctors with something that I know more than them about. And say, just to get it on record, even.
Yeah, and actually the test that you're referring to is about $100 more than that now,
Oh, is it?
including shipping. Yeah.
But interestingly enough, my veterinarian sent me about 4 documents just the other day for my dog Otis, the pug. Lyme disease is here, it said, and we recognize Lyme disease and it's here, and your dog may contract Lyme disease and come in, and this is what you can do for your dog, but not for you.
Actually, most provinces in Canada now, except BC, at least not any information that we can confirm, and we've asked, but most provinces in Canada are now using the initial screening test called a C6 peptide ELISA test. Now, it's better than the screening test they were using just 2 years ago. That C6 peptide ELISA test is what your dog gets. If they suspect Lyme disease, they'll use that peptide test to test your dog. Up until recently, it was only ever licensed in Canada for dogs. However, it was developed as a human test. And we questioned them for years as to why humans couldn't get this test. And we were just told, well, it's not licensed. Well, it is for dogs. You know, well, how come they couldn't? So it is better. But in, of course, all this wonderful wisdom of the leadership within our healthcare system, they introduced this much better test, but they kept the same old Western blot to confirm it. So this C6 peptide test is picking up more strains of the bacteria. So if it's positive, it has to have the confirmatory Western blot. It's the same old Western blot looking for the same old Borrelia burgdorferi laboratory strain B31. So it completely negated the value of the C6 peptide test in humans. And if you're a dog, they don't confirm it. If you get a positive C6 peptide, they treat the dog for Lyme disease. There's just absolutely no common sense. There's no justification from a science perspective to be doing what they're doing and calling it an effective protocol or test for Lyme disease.
Is there only one type of tick that carries the bacteria, or is there several different types of ticks?
Well, there's, everybody hears in BC, either a tick is a wood tick or it's a deer tick. And it's the deer tick that is most responsible for transmitting Lyme disease. The deer tick, though, is a species of tick called Ixodes. And within the Ixodes species, there's Ixodes pacificus, Ixodes angustus, and Ixodes murus, and other Ixodes. Most commonly, what we have that's infecting humans in Canada is, and BC in particular, is Ixodes pacificus and Ixodes angustus. They're a much tinier tick than the wood tick. The wood tick can carry Lyme disease, but of all the researchers that I've spoken with, it's very unlikely to be an effective transmitter of Lyme disease. And I can get into some very detailed reasons in science for that, but it's to sort of sum it up, it is, they have a substance in the hemolyns, which is the tick blood, that actually kills the bacteria, whereas the Ixodes tick does not. And the other part of it is there's other ticks. Because we all travel, I should speak more about outside of BC as well. So in most of Canada, we've got not the wood tick, but what's called the dog tick. And it too is the same as far as we understand, that it can carry the disease, but it's not an effective transmitter of the disease. There they have Ixodes scapularis, which is similar to the Ixodes pacificus, but we're starting to see reports of a more aggressive tick. Most people, if they're bitten by an Ixodes tick, it's sort of not the meal of choice for the tick to bite a human. But there's another tick that's in the United States that seems to be migrating into Canada now, called the amblyomma tick, and or the Lone Star tick. Now that tick is actually very aggressive. It'll hunt you down and feed on you, and it's carrying strains of the Borrelia that are affecting humans. And so I don't think to date we've seen that tick in British Columbia, but and I don't know if we will. But it's another one that have to worry about. I'm sure as time goes on and science improves and more field research is done, there's a real lack of field research, and this is why we never did understand why the government thought they could label areas as endemic or non-endemic. Just because you didn't look does not mean an area is non-endemic, but that seems to have been their methodology all this time. And unfortunately, that affects severely the number of diagnoses that come out of those areas. Once, as soon as they started saying, okay, you know, the area around this park in Vancouver was endemic for Lyme disease, they started seeing diagnoses go up because the doctors were, oh, maybe I better pay attention to this. So again, going back and trying to label areas as non-endemic or areas of low endemic nature has been extremely harmful to the people, because it's really disarmed the doctors, and the doctors really don't have the time. You know, they're trying to run a busy practice, and so they rely on this tidbits of information that they get, and they don't have time to sit down and read detailed research. So they look at these major talking points. 80% of rash, okay, need the rash. 60% arthritis, okay, got to see swollen joints. they don't have the time to look at the detail and discover the many, 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 many nuances of a disease as complex as Lyme disease. It's an extremely complex disease. In diagnostics, it's complex. In treatment, it's complex. In outcomes, it's complex. So there's just so much we don't know. And it's like the whole field of vector-borne disease in general. It's what we don't know that we should be worried about, because as science improves, we are detecting more and more of these pathogens. And it's why I say we should be worried about it is not necessarily that we're going to suddenly find all kinds of pathogens that are attacking humans, but it is the fact that for too long we've only been emphasizing the very little that we do know about. And so they've been making all these wonderful statements of confidence about, and then that's it. They've solved it all in the mind of the doctor and in the mind of many people, when in reality, people and doctors should have been had their antenna up, long ago for some of these infections. Yeah.
Do the Canadian Lyme Association have a list of doctors that will treat it? Because when I was on that other seminar, a big majority of them did not want to, if you had it, didn't want to treat it because they'd be persecuted because it's such of a, like you said,
Nothing's changed.
nothing's changed. So you have to do, like Marinaki said, look for a doctor that's willing to admit you have Lyme's and treat you, because most of them won't.
Yeah, the medical system itself hasn't changed, but as we're going to get into, there is as I know some of you have been in this discussion group before, we in BC now are much better off because we have naturopathic doctors now who have been granted the right to prescribe. Those who have written and passed the provincial pharmacology exams can prescribe the necessary antibiotics, and a handful of them have now taken up Lyme disease, and you had a question.
Right. No, I just wanted to introduce myself. I am a naturopathic doctor, so I'm Dr. Tamara Brown, and I practice in Okanagan Falls. And I just want to say that really we are the doctors that are treating Lyme disease. We have our own governing agent in British Columbia. We are a self-governing profession, so we don't have to follow the same guidelines that the medical doctors do, and we do have prescribing rights now. So we are the doctors that this is sort of has landed on our laps, whether we want it or not, and we recognize that it is, we know how to look at the clinical symptomology and determine whether it's likely to be Lyme or not, and then we will do the testing through IGenics. Unfortunately, it's not covered by MSP, so it's a conundrum for patients because often they can't work and have very little income, and they have to pay for, expensive testing and treatment. But that's your best option, is to see a naturopathic doctor, because we don't have the same limitations that medical doctors do. We won't be losing our license if we treat Lyme disease.
Jim, do you want to just touch on it now that it's springtime and the ticks are upon us, almost literally? If someone does find a tick buried in them, the proper method for removal and why?
Yes, it is tick season, and I know that firsthand because I got a call last week from a veterinarian who had a horse with 300 ticks on it, not too far from where I live in West Kelowna. I suspect most of those ticks were likely the dermacenter tick, but we'll wait and see once he's collected them all and have a look. So it's definitely tick season. Now, if you or your child or somebody does get a tick, the best way to remove a tick, the most effective way, is fine tip tweezers going underneath the mouth or the body part of the tick. Do not touch the gut of the tick. So you get it right where the mouth part enters the skin, squeeze hard, and then just a steady pull backwards and pull that tick out. Do not twist it, do not turn it. You don't have to do any of that. There's other tick tools out there, and they're little, almost like little crowbars, and you just slip them under the mouth part of the tick where it meets the skin and just pry it backwards, and it just pops the tick right out. They're very effective too. Once you do remove the tick, you should apply antiseptic to the area to kill anything that might be. Anytime the skin has been punctured, there's a potential for infection. So that tick has punctured your skin, so apply an antiseptic. And then of course you're going to watch for any symptoms of course. Now there's a real argument about whether a person should seek antibiotic treatment just on a tick bite. That's a tough one to say, because most tick bites aren't going to be problematic at this stage. But again, if it were me and it were one of my children, I would likely opt for a round of antibiotics if that tick was swollen a little bit. So in other words, if it had a chance to feed on the blood, so if it had started to swell up with the person's blood, then I would be in favor of a round of antibiotics, because it's this early time that is the most critical time to prevent the entire infection from taking hold. And it's, antibiotics, there's a lot of controversy over the antibiotic resistance that it causes, and other gastrointestinal problems that they can cause in the person. The way I look at it is, you have to weigh the risk, and the risk to benefit, in my mind, when you look at what chronic Lyme disease can do, is to treat. Talking about antibiotic resistance, I think it's kind of a silly point to be talking about withholding antibiotics in humans when our food farm industry is using 8 times more the antibiotics than human consumption. So in fact, there's a court case going on in the United States getting the US FDA to fess up to provide their documentation. The antibiotic manufacturing companies are supposed to be providing that information to the FDA every year. I don't know that there's any such requirement here in Canada, likely not, because we just sort of take all our direction from the United States. But the FDA has not been reporting any numbers, and they've refused every Freedom of Information search. So now they're being challenged in court to release those numbers. Because at this point in time, it is pointless to be refusing to treat a human with an antibiotic while we're shoveling it into our fish farms, our chicken farms, our pig farms, into our cattle feed. I noticed the commercial on TV recently for one of the hamburger outlets, fast food outlets, bragging about, we don't put this in our beef and we don't do that. Not one mention about their beef being antibiotic free though. And they feed them well and they do all this, and so you come and eat my meat, but you may be lacing yourself with antibiotics. And our concern about the whole antibiotic resistance thing is when you take something the size of a cow and the number of square meters of leather out there exposed to all of our mosquitoes and black flies and every other insect that's feeding on the cows all day long out there, And if their system has always antibiotic in it, an antibiotic residue, every bacterial organism that's in those mosquitoes and the black flies and everything over the last 4 or 5 decades has been gradually becoming more and more resistant to antibiotics. The effect the human has had on this whole process has been minimal, and where you see that most is where it's concentrated in our hospitals. And that's where most of the antibiotic resistance is being seen in that. But currently, we've got a huge problem in our food farm industry. And if we just stopped, like the European Union has done, outlaw it, don't allow it in the food farm industry, then we could extend the number of years that we could get away with treating Lyme patients while we look for better treatments, better diagnostics and everything. But right now, to just use the antibiotic resistance excuse for not treating humans, to me, it's not only insulting, but to me, it borders on almost criminal, because it's allowing one group of elite medical leadership to decide the fate of thousands upon thousands of other human beings. And it's only their opinion that counts. And that's where we're at right now.